A common question I get in my OCD psychiatry practice is this: Doc, do you think I may have ADHD? Or, I heard ADHD treatments can help with my OCD. Is this a good option for me? And given some of the latest research and my own clinical experience, those are not unreasonable questions to ask. So today I'd like to take a look at the overlap between ADHD and OCD, what it looks like if you do have both, and some of the treatment considerations for these two conditions. And at the end, I'll give you my own clinical insights as a psychiatrist who treats both on a daily basis, including some things I think too many clinicians overlook. But first off, for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And on this channel, I enjoy making educational and mental health videos. And as always, these are educational videos, not mental health advice. And if you are experiencing any mental health symptoms, please seek the care of a local mental health care provider. So before we talk about what it looks like if you do have both of these conditions and some of the treatment considerations for that, let's first talk about why the two conditions are so often confused for one another. I often hear the same chief complaints from both patient groups. Things: I can't focus, I'm mentally exhausted at the end of the day, I jump from thing to thing, I can't get anything done. But here's the thing, the outward behavior and the struggles may look identical. But if you dig under the surface of what's driving it, there are some differences. So let's take an example most of us are familiar with: answering emails. Someone with ADHD may open up their email, notice a bunch of unread messages, start going through them, then check their phone or open up another tab, and before they know it, they're reorganizing their desk. Their attention keeps shifting, and it's also being driven by seeking novelty. Now let's take the example of someone with OCD. They may open their email, and they might start going through some of them, but then there's an important email, and then they might hesitate on answering. Their attention will get stuck on the thoughts of, am I coming across correctly? May they think something negative about me? Did I accidentally put something into the email that I didn't notice and now will have repercussions on me? Should I review the email one more time before sending? So their attention wasn't wandering. Instead, it was trapped. It was hijacked by anxiety. So we have two different examples. Neither person can send an email and they get stuck and behind on them, but for very different reasons. Later in the video, I'll go over a little bit more detail of how I differentiate between the two in the more nuanced cases. But now let's take a look at what happens, what it looks like if you have both ADHD and OCD. Because the fact is, many people do have both conditions. And research shows us that if you have OCD, you're much more likely to have ADHD than the average person. In fact, studies show that 1 in 6 people with OCD also have ADHD. And the numbers could potentially be higher. And clinicians who work with ADHD and OCD have to keep one thing in mind. Severe OCD can look a lot like ADHD. And that's because in OCD, too often your internal monologue, your thoughts are interrupted by intrusive thoughts. They come intruding in and have you engaging in mental rituals, checking memories, checking in to see how you feel about something. And that can make it very difficult to focus on anything. So almost in all of my more severe OCD cases, there is a major attentional component as well. And the reason it's really important to understand if you have both ADHD and OCD is because they can both feed each other. They can both make the other condition worse. Let me explain. ADHD makes it hard to stay organized, and OCD makes it hard to let things go. OCD can demand that things be done just right. Then ADHD can make it hard to stay engaged with things. And unique difficulties in each of these conditions makes treatment for both much more difficult. And that's because for OCD, exposure response prevention is the main therapy for that. But that requires a good degree of focus and commitment and consistency, all of which become more difficult if you have ADHD. So oftentimes when I have people come in who've tried ERP therapy for their OCD and it hasn't been very successful, I dig into why that is the case. And sometimes I will hear that they just struggle to do the exposures throughout the week. They struggle to be consistent with it. They struggle to stay focused during their sessions and the homework they have in between sessions. Oftentimes that rings alarm bells that is there ADHD going on? So a lot of self-blame can come with that, understandably so, because people will kind of blame themselves of, I'm just lazy, I'm not committed. And in reality, they're really working hard, but just struggling because of the underlying ADHD. And the struggle is real because when you have both of these conditions, you have your attention being pulled in two opposing directions, both working against you. ADHD is pulling your attention towards novelty, and then the OCD is pulling your attention towards certainty. So it's no surprise that people who have both conditions can struggle so much in treatment. So how do I take all of this into consideration in my own practice? Because I treat a lot of patients with OCD, a lot of patients with ADHD, and a lot of patients with both. Well, in the initial sessions, one of the things I ask myself isn't, can this person pay attention? Likelihood they can't with either condition. What I ask myself is this: what is pulling at their attention? If someone's attention is constantly being hijacked by something that's new, novel, or exciting, then I think more ADHD. But if their focus is constantly on fear, uncertainty, needing to make sure something is right, then I think more OCD. I also get a better sense of trajectory of symptoms. Oftentimes ADHD is pretty consistent throughout someone's life. So it can of course get better and worse throughout different periods, but it's always there for the most part. OCD can sometimes come up later in life, or it can definitely morph over the course of someone's life, but be there to varying degrees throughout. Another one is, of course, family history. There's a high genetic component to both of these conditions, so getting a good family history is also really key. And of course, I also do a full assessment of symptom clusters for both OCD and ADHD. But I never, ever diagnose ADHD in anyone who has severe OCD. That's because it's just too hard to tell in those situations. First, you might want to tackle the OCD symptoms first to get a clearer sense of how much is there just a pure underlying ADHD there as well. And if anyone's interested in a full video about how to differentiate ADHD, OCD, and more on the overlap between the two, let me know. I'll be happy to make more videos on this topic. Even outside of these two conditions, attention is the battleground for most mental health conditions, whether that be schizophrenia, depression, panic disorder, many others, PTSD. Attention gets disrupted in all of those to some degree. Our attentional system is a very fragile function of our brain, so it's very prone to any disruption. And I definitely want to make something clear. Even if you may have ADHD and OCD, that does not make you more treatment resistant. Because if you have a clinician, a team working with you that is able to address both, then your symptoms can resolve just as much as anybody else's. So things can definitely still improve even if you have both. Okay, so what does all of this mean for treatment? Well, for some people, I think that all of this may translate to, well, if I have ADHD and OCD, then I should just automatically be on a stimulant. Not necessarily. I personally rarely reach for stimulants as the first option for these cases. And that's because focusing on attention hygiene is critical whether or not you have ADHD. And what do I mean by that? Well, I've made some videos on it in the past, but your attention can be very easily disrupted, especially in the modern world. And because whether or not you have ADHD, practicing good attention hygiene improves your OCD, improves your depression, anxiety, or even if you don't have any mental health conditions, it just improves your general well-being. So what does that involve? I tell this to all my OCD, all my ADHD patients is there'll be a ceiling to which treatment improves your symptoms if you don't do these things. And the first one I always talk to people about first is doom scrolling. That has a major impact on people's ability to sustain attention. And it makes you more distractible, makes you more internally and mentally restless. And if you're very distractible, guess what? Intrusive thoughts will distract you more often. It'll be harder to pull away from intrusive thoughts. It'll be harder to focus on things, and it'll worsen your ADHD symptoms. And then, of course, all the other good things are so important, just having a fulfilling life. So maintaining exercise, regular sleep, good diet, hanging out with friends, with people, filling your life with things that align with your values. Without this as the foundation, therapy and medications will help, but only so much. And then there's the question of using stimulants. And yes, stimulants are very effective in ADHD, and there have been studies showing that methylphenidate, which is a stimulant, otherwise known as Ritalin, can be effective in OCD. Of course, these are small studies, but they have shown positive results. And in a bit, I'll get to my own clinical experience with this. Because in some people, stimulants can worsen OCD. They can make intrusive thoughts and anxiety worse and make compulsions more prevalent. But in others, they don't. And some evidence even shows that they can reduce these things. So now I'll give you my take on it, kind of what I see in practice in my own clinical experience, along with chatting with my colleagues who also treat a lot of OCD. This is what we see. Typically, if someone does actually have ADHD and OCD, starting a stimulant typically doesn't worsen their OCD. Most often, it does improve their OCD symptoms in general, outside of just improving the ADHD. They find that they're more mentally quiet inside. Less intrusive thoughts are coming up. They're engaging in less reassurance-seeking behaviors, and their compulsions subside a bit. This isn't for everyone, absolutely not, but we do definitely see this. I suspect a big part of this is that intrusive thoughts are very distracting. They're internal means of our brain getting distracted by something else. And a stimulant sort of quiets just the mental noise going on. It allows you to sustain attention on one thing at a time. And that allows you to be more present. So I suspect that by that mechanism, it allows for less intense OCD symptoms. That's not evidence-backed, that's just my clinical suspicion. And then the other factor is this. I find that a lot of people who have OCD and ADHD struggle to engage in ERP treatment just because they're struggling to keep up with homeworks, struggling to do exposures every day or in session, and starting a stimulant can get them just well enough to be able to actually do these things. And their therapy just goes a lot further in reducing their symptom burden. So that's another potential benefit. I won't go over all the risks and benefits of stimulants here because they definitely do come with their own drawbacks. And they only work for a certain period of time before wearing off, and then tolerance can build up as well. So they're not ideal, but they do have their place in treatment. Of course, taking any stimulant, any medication should only be done under the close supervision of a mental health care provider. And I also find this, always using the lowest possible dose, as infrequently impossible, is always the way to go with stimulants. I oftentimes do get patients that come to me who've been put on these massive doses of high dose Adderall, taking it daily, and then they get this tolerance build up, all these side effects, and they can't function without it. That can come up in some cases, so I'm always wary of that. Everybody is unique and no one treatment approach is ideal for everyone. So in conclusion, I want to shed light on the overlap between ADHD and OCD, that both can happen together, and that an astute clinician should always take into consideration the role of both conditions in someone's presentation, in their experience. And regardless of whether ADHD is present or not, attention may be disrupted, and taking note of that and addressing it is also key. And thank you so much for watching to the end. I really appreciate you giving me your attention. If you found this helpful, useful, please consider liking and subscribing. Definitely helps out. And I hope to see you next week in another mental health video. Thanks.